The second thing that caught my eye very much was to do with the hospital investigation. So I'm going to just remind you of that now. Healthcare inquiry. A hospital is under investigation for pursuing a natural birth ideology that may have endangered mothers and babies. So, yeah, I was interested in this, obviously, because it's to do with the natural birth ideal. We we have a ideal, I suppose, that it's lovely as a mother if you can give birth naturally. It's something that is aspired to. However, that's not always necessarily how things go. And from the perspective of looking at children's health and well-being, we've already covered the poverty angle. At birth, think about trauma at birth and how that can have a knock-on effect. So I found that very interesting and thought, right, okay, I keep saying interesting, but that's true. It is very interesting. So with that in mind, I decided to ask AI about the hospital, the problems with the hospital. I just put in, give me more information on the hospital that was mentioned in the news last week, who are under investigation for pursuing a natural birth ideology that may have endangered mothers and babies. And the hospital that underwent investigation is Leeds Teaching Hospital National Health Service Trust, which has been accused of pursuing a natural birth ideology that may have endangered mothers and babies. So it goes and gives you the key facts. So we've got the hospital identified. Period of concern is between 2012 and 2023. So we're looking at an 11-year period. Leeds had the lowest caesarean rate in England, but simultaneously recorded some of the highest rate of stillbirths and newborn deaths. The ideology promoted in its 2015 maternity strategy, the Trust explicitly encouraged staff to promote normal or vaginal birth with minimal medical intervention. The alleged consequences, critics argue this led to delays in medical intervention during complicated labours, overuse of forceps, and avoidable harm to mothers and babies. So, in national context, Leeds' approach came after the Morecambe Bay scandal. I'm not sure if you remember the Morecambe Bay scandal. We won't go into it completely now, but I do have the report for that. That's mentioned. Similar prioritization of normal births was linked to avoidable deaths. This has reignited debate about whether National Health Service maternity culture has repeated past mistakes. So the government's response was the Department of Health has launched a national investigation into 14 National Health Service trusts over maternity and neonatal safety, including Leeds. And Baroness Amos has been appointed to lead the inquiry, aiming to produce a new national action plan. Okay, so we'll have a look. These are the trusts that are being investigated. So we've got Barking, Havering and Redbridge, Blackpool Teaching Hospitals, Bradford Teaching Hospitals, East Kent Hospitals, Gloucestershire Hospitals, Leeds Teaching Hospitals, Oxford University, Sandwell and West Birmingham, Shrewsbury and Telford, the Queen Elizabeth in King's Lynn, University Hospitals in Leicester, University Hospitals of Morecambe Bay, again, University Hospitals of Sussex, and the Somerset National Health Service Foundation Trust. So they are the 14 trusts that are being investigated. So we have various reactions to this. And the very first reaction that came up had me tickled a little. Um, the first reaction that came up was that from our former health secretary, Jeremy Hunt. Have to be very careful how you pronounce that name. And he described normal birth ideology as killing babies, stressing that cultural failings in maternity care have persisted despite reforms. So there's a link, and I clicked on the link because I thought, right, I'm gonna have a look. I'm gonna have a see what he says. Because I mean, he published this, or they published this, in the Sunday Times on the 9th of November. During my time as health secretary, nothing caused me more anguish than the repeated failures in the National Health Service maternity care, the avoidable deaths of babies and mothers, the anguish of families who trusted the system, and the reports that exposed the same cultural failings again and again. So he's come out of the he's come out the gate fighting. And while what he says is true, we have to be able to put his opinion on the matter into some form of context. So I asked Copilot about the controversies when it comes to our Mr. Hunt, Sir Hunt. So we have an extended line of Jeremy Hunt's controversies. So in 2009, there was the expenses scandal. He's ordered to repay £9,500 for breaching parliamentary rules on second home claims. This is the man that's commenting on the natural birth scandal. Okay, 2012 to 2018, National Health Service criticisms. As health secretary, he was accused of underfunding and worsening staff morale. 2016, we have the junior doctors' contract disputes. So that's strikes erupting over new contracts. Hunt accused of damaging trust in the National Health Service. 2018 to 2019, he was Foreign Secretary. He wasn't the Health Secretary then. And he was criticised for handling of Saudi Arabia, Iran, and opposition to a second Scottish independence referendum. 2019, in the SNP dossier, he was accused of extreme views, dodgy dealings, and ministerial failings. 2022's appointment as Chancellor became Chancellor after Kwasi Kwarteng's disastrous mini-budget. Hunt was seen as stabilising figures, but faced criticism for reversing tax cuts and imposing spending restraint. 2023 to 2024, economic challenges. Criticised for failing to curb inflation quickly, with opponents accusing him of austerity by stealth. His budgets were attacked for squeezing public services while protecting wealthier taxpayers. 2024, political fallout after heavy Conservative losses in local elections. Hunt admitted the party cannot rule out extinction, a rare public acknowledgement of crisis. And in 2025, post-Chancellor reflections, now a backbencher, Hunt has been publishing board manifestos and reflecting on missed opportunities, with critics calling his vision bland ambition. So when it came to Mr. Hunt's article that was published in the Sunday Times, I have to say, no, I'm not interested at all in what he has to say. So, getting back to the voices. So, that was a public voice, political voice. Families and campaigners. So, bereaved families have spoken out, saying they felt pressure into avoiding caesareans and were not listened to when complications arose. And the professional debate, some midwives defend the philosophy as empowering women, but critics argue it became dogmatic, prioritizing ideology over safety. So, it's the investigation is highlighting a tension between promoting natural birth and medical safety. While reducing unnecessary interventions is a valid goal, the Leeds case suggests that rigid adherence to ideology can have tragic consequences. The national inquiry will likely reshape maternity policy across the National Health Service, balancing maternal choices with robust safety protocols. So I asked Copilot to tell me more about the 14 trusts. Um, and it was interesting. The purpose of the investigation it covers, we've already mentioned most. The probe will examine how maternity services across England have ignored women's voices, improve care and safety. Recommendations will be made to urgently raise standards, consult bereaved families, and also address toxic cultures. So bear that in mind. Oh, that's our Jeremy Hunt. This is the report into the Morecambe Bay investigation. It's called the Kirkup report. And getting back to this address toxic cultures, the report suggests cover-ups and normalisation of harm have occurred in some trusts, which the investigation claims aims to confront. And the Kirkup, one of the key findings was the existence of a culture of denial, collusion, and cover-up within the trust. The inquiry revealed that staff were reluctant to report or acknowledge mistakes, and there was a general lack of accountability. This culture significantly contributed to the persistence of poor practices and the inability to learn from adverse events. The report also highlighted the inadequacies of the regulatory and supervisory bodies, which failed to identify and address the issues at Morecambe Bay in a timely and effective manner. So that's the Kirkup report. So they have already looked into these in a separate report, in a separate investigation. So I asked it to tell me more about the specific failings in Leeds, and it came up with what we've already covered and the fact that the independent inquiry is going to look into all of those matters. Um, I looked into the Morecambe Bay scandal. That's something that is good from a research point of view, because a lot of the controversies in that investigation in the Kirkrup report highlight how a lot of things haven't changed over time. So from that perspective, I do believe that this investigation, if it can come in and do something right the way across, as in a policy level, right the way across, to make suggestions for how something can be viewed in all of the trusts that are involved, then that can't be anything but good. But I didn't understand why they were really concentrating on this concept of the normal birth. And I didn't know what they meant by normal birth ideology. I mean, they've obviously said that the trusts have pushed forward a normal birth ideology, which I understand. But they're saying that, and the investigation is that the normal birth ideology was pushed and everything else was almost like it was taken away. So that I didn't understand. So I asked AI. So the debate around normal births, it centres on whether promoting vaginal births with minimal intervention empowers women or endangers mothers and babies when applied dogmatically. And that's the question, really. What normal birth ideology means. So, a philosophy that prioritises vaginal birth without medical intervention. It's rooted in midwifery traditions and feminist movements that sought to reclaim childbirth from over medicalisation. The policy influenced National Health Service trusts, including Leeds, embedded normal birth targets into maternity strategies, encouraging staff to reduce caesarean rates. So then we have the criticisms of the ideology again. And then we have the defences of the ideology. Supporters argue it gives women agency, reduces unnecessary medicalisation, and respects natural processes, which it does. Global parallels, similar debates have occurred in Australia and New Zealand, where vaginal birth at all costs were also linked to safety concerns. And a balanced view, some midwives say the problem isn't the philosophy itself, but poor implementation and lack of listening to women's choices. So I also asked about the toxic cultures, address toxic cultures, because from a natural birth ideology point of view, that's not a toxic thing. That's a natural thing. So that's not toxic. So what's the toxic culture? So the toxic culture is silencing staff. So junior doctors, midwives, and nurses often reported being ignored or intimidated when raising safety concerns. So this is if a child or if a mother has requested a natural birth and a safety concern comes up, what junior doctors, midwives, and nurses are reporting is that when they voiced concerns to senior members of staff, those concerns have been ignored or they've been intimidated for raising them. Cover-ups. So records were affected or destroyed to protect reputations rather than learning from mistakes. That's not good. Pursuit of normal birth at all costs created pressure to avoid caesareans, even when medically necessary. Blame and fear. Staff feared repercussions for speaking out, leading to underreporting of incidents and missed opportunities for improvements. And families were dismissed. Parents who questioned care were sometimes treated as troublemakers rather than partners in the safety. So the investigation wants to look at all of these points. Do you know that all of those points are valid and they all need to be investigated 100%? But I do not get the understanding that this is all to do with natural birth. And the headline was about natural birth. Jeremy Hunt, natural birth, killing babies. I mean, at this point, my argument from a researcher point of view is just from asking those few questions, I'm now understanding that those headlines were quite sensationalized because it isn't the natural births and killing babies that is being investigated. It's the procedures and policies that are in place in these trusts that are ignoring what their staff have to say when it comes to intervening measures. So I then, one of the big voices that are obviously talking about this situation is the Association of Radical Midwives. So this report is by a lady called Gillian Meldrum. She posted this on the 31st of July this year, and she was talking about normal birth, and it was in response really to Jeremy Hunt, I think, in a lot of ways, but also to the Morecambe Bay by Kirkup. And what she's pointing out is that there's a big, basically what I've just said, there's a big difference in natural birth ideology and how it came about. So origins of the phrase and its meaning. The phrase Pursuit of normal birth at any cost. That phrase came up in the Morecambe Bay investigation. That's the first time it came up. Um, and Jill says, we all know it was not meant literally. If that was the case, there would be no caesarean births at all, and midwives would be prepared to pay the price at any cost. So the sensationalization of the saying is too grave as well. And she talks about what the Kirkup report actually said. So, firstly, it's important to note that he included it as one item in a list of failures in a seriously dysfunctional service with clinical incompetence, deficient skills and knowledge, extremely poor working relationships, failures to risk assess. So, in a seriously dysfunctional unit, a new, dominant, and bullying senior midwives influence practice, leading to unsafe care. But their malign influence clearly extended far beyond the pursuit of normal birth. So, it's leading to appropriate intervention sometimes being withheld. It also included tolerance for any other kinds of clinical incompetence. For example, the tragic case of James Titcom's son, Joshua, who died as a result of infection that was missed for 24 hours. So Kirkup's investigation concluded with 44 recommendations, none of which related to the pursuit of normal birth. So again, the headline has been sensationalized. And all of this and the confirmation from Jill is leading me to believe that the headline that first hit me, that I thought I'm going to have to look into this a lot deeper, was sensationalized. So, how the narrative spread. Here we go. The Guardian presented the cult of natural birth has gone too far. The cult of natural birth has gone too far. The Daily Mail, a dangerous obsession with natural childbirth. And this is all despite there being no use of the words cult or obsession in the Kirkup report. Dramatised, sensationalised. And she says it's understandable that the mainstream press seeks dramatic, simplistic, and potentially misleading headlines to attract the reader's attention. But the result was that the more objective findings about dysfunctional organisation and incompetent care were less widely discussed. She says, I have no doubt that these failings had an impact on many different women and babies, including those who achieved the birth they wanted, whether physiological or caesarean birth, as well as these who experienced tragic, avoidable adverse outcomes. And subsequently, the phrase was repeated during the parliamentary inquiry. So, I mean, she goes on, she covers a lot. She was obviously very upset by the reporting of the inquiry. And this was key to me, something that I hadn't known. The inquiry held a roundtable discussion with midwives and reported the majority of attendees had not experienced a culture that promoted normal birth at the expense of safety. Despite this, the inquiry concluded that the most important focus for safe and personalised care should be to ensure that no woman faces pressure to have an unassisted vaginal birth. Furthermore, these organisations need to work hard to stamp out the damaging ideological focus on normal at any cost, which caused such huge loss and suffering. That was her quoting the Jacqueline Dunkley. If you read the transcript, it appears that the committee held this opinion from the outset and repeatedly invited witnesses to confirm this viewpoint. From a research point of view, if you go into an investigation or research with a preconceived idea of what you're going to find, then you will make the puzzle pieces fit the narrative that you would like. And that's what she's pointing out. No attempt was made to scrutinise evidence that such an ideology really existed or to reflect on how it might best be addressed. No academic midwives were called to provide evidence, and the only parent witnesses were those who had experienced a baby loss. There was no consideration given to possible experiences of pressure to have unwanted or unconsented interventions. So, from that point, it skewed the data and it skewed the information because they only asked parent witnesses who had experienced a baby loss. They didn't ask any of the mothers who had experienced um, a good labour. They didn't include them. So you've immediately skewed your data. So bless her heart, we like Jill. So she's reclaiming support for physiological birth as acceptable. So it is nothing new to say that physiological birth is inherently dangerous and only safe in retrospect. But this recent concern, the pursuit of normal birth at any cost, has taken it to a new level. Now, anybody who supports, encourages, and protects physiological birth might be accused of having an ideology which must be stamped out, an ideology which entitles staff to pressurise women and colleagues to do whatever they think is right. Might indeed be an ideology which needs to be stamped out, or, to put it more gently, which should be questioned and transformed. So that's the author, Gillian, retired midwife. She's worked in the national health sector for 40 years, doing case loading midwifery, practice development, and infant feeding. She lives in London. She's keen to help the Association of Radical Midwives make a positive contribution to addressing the crisis in UK maternity services. So she's got a great voice, and it's well worth reading the whole article. The Pursuit of Normal Birth at Any Cost is the article. And she also wrote, is avoidable serious harm in childbirth associated with normal birth ideology or not doing our job properly? And she wrote this later. It's the 15th of October, same lady. And it was commenting on the National Maternity and Neonatal Investigation Terms of Reference. So this is commenting on what is to come. So it's official. The concept of pursuit of normal birth at any cost will be considered in the National Maternity and Neonatal Investigation. So its scope includes understanding the impact of specific professional boards and approaches. So this is the Baroness Amos report that is now going to be taking place. So she goes through the ideology again, and again it's a great piece to go and read all the way through. But I wanted to make note of her later comments. Where is it? To help birthing people achieve the birth they want when their preference is physiological birth with a safe outcome, it goes without saying. Midwives must be skilled and knowledgeable about how to optimize physiological birth. Monitor for any problems which indicate a recommendation for intervention. Understand and offer information about all options. Facilitate decision making, escalate and implement interventions promptly and safely. They also need to be able to sensitively and candidly support families when they have not achieved the birth they wanted. Exactly the same knowledge and skills are needed to provide care when people are recommended or requests interventions. I would say that if there really is a harmful ideology present at times in maternity cultures, it's a belief that we, the professionals and experts, know best, can tell birthing women what they should or shouldn't do, and have no need to really listen to them or take them seriously to inform our practice. Although nobody will admit to having this kind of attitude themselves, we have all witnessed it going on around us. This attitude often assumes an expertise which in reality is unfounded and more commonly based on experience of how we do it here rather than an in depth understanding of the evidence. And it is no more linked to normal birth ideology than to a medical model ideology. It's really important that advocacy for birthing, people's choice and autonomy, and doing the best we can to support them to have the birth they hope for is not equated with maternity staff providing unsafe or coercive care. Unfortunately, optimal care is not always achieved, and we do need more investigation in skills and resources rather than an ideological revolution to ensure we all do our job better. Advocacy for physiological birth, when this is what birthing people want, must not be blamed for avoidable serious harms and death. So really she's doubling down on what I said about the need to give choice and to have policies in place that encompass and pull in the mother's choice. So this is the gov.uk that she was responding to, the National Maternity and Neonatal Investigation. This is from the .gov website. You can find it if you'd like to have a look for yourself. So the scope, we have the aims, which we've already read, we know. The scope. So the investigation is to understand the lived experience of women, babies and families in England at all stages. So they're collating and learning from experiences recounted by families, learning from the experience of women, babies and families who've been harmed, understanding the impact of adverse experiences on physical, mental and emotional health, understanding the impact on individuals and families, including social and economic costs. So they're doing the 14, it says 12 there, undertaking local investigations into maternity and neonatal services in 12 National Health Service trusts. So they want to identify the drivers and impacts of inequalities. So the investigation aims to identify the drivers and impacts faced by women, babies and families from Black and Asian backgrounds, those from deprived groups, those from other marginalised groups when receiving maternity and neonatal care. So this will include understanding drivers of adverse outcomes and poor experience, racism, discrimination, lack of cultural sensitive care, language barriers. So understanding the experience of staff and healthcare professionals. Now this gets back to that toxic culture we were talking about. The toxic culture, and when we spoke about the silencing of staff. So understanding the experiences of staff and healthcare professionals, understanding how organisational culture and leadership styles influence staff, identifying the extent to which recruitment, retention, education and training support staff as they deliver care across the maternity and neonatal pathway. So examining the response of healthcare organisations, reviewing previous recommendations. Now this will be interesting. The investigation will undertake a thematic review of previous recommendations that have been made by public inquiries and national investigations into maternity. So they're going to look back. So they're going to take in to the Kirkup report. So identify how many were implemented, understand the impact of those recommendations, identify the reasons recommendations have not been implemented, identifying opportunities and barriers to potential improvements, assessing examples of good practice, investigating revenue and capital investment, and then they go through their methodology, which is basically a breakdown of everything that we've already covered. So we won't go through that. And there's the list of the chair and the advisors that will be. So the independent investigation will report to an independent chair, Baroness Valerie Amos, and she's supported by this team here. So the investigation started in summer of 2025. Some initial findings will be published this month. So we will move forward with this ahead of further findings in spring of next year. So definitions, we already know. Interesting that they haven't put natural birth at all cost into their definitions. So one would hope that Jill's point about that not being the problem, that the actual problem lies in the implementation and the understanding and the communication between not just organisational trust staff, but also between mother and trust staff. So this is definitely going to be moved on as part of my research. And just to give the last word, Royal College of Midwives. We must not lose sight of the progress already made in many maternity services. We need to build on that progress, share examples of good practice, and make sure learning from the investigation is acted on swiftly so that real improvements are delivered for women, families, and staff. It should not be the case that in 21st century Britain, Black and Asian women are disproportionately more likely to die during childbirth or soon after, or that their babies are more likely to have poorer outcomes, said Jill Walton. The RCM is pleased that this investigation will address this alongside the inequalities facing women from deprived backgrounds. So that was the Royal College of Midwives' response to the investigation. So I thought I'd give you that as an update of where I've got to with this investigation so far. I will be keeping an eye on the whole movement forward with that research. It's paramount that we have our children come into this world in the safest and obviously most productive way possible. And if that safety means that we have to implement policies that give everybody an understanding of where they stand when it comes to the birth, then I think the investigation is a good thing.